愿照路不梦变着，我学不选他，他打给我着我。你的那让你我去，到落地撒点要让我离。Kau kecil satu tashi waneng sati nyata hampir teno.
Nhớ trong ít trong này chỉ có tin trả xã sim nó sẽ tăng cường good afternoon, Lieutenant Governor Peggy Flanagan. Can you hear me?
Good afternoon. It's good to see you.
Just let that mic on. That music on. Just pose over there.
Okay.
Okay.
All right. Can you hear me now?
I can hear you. Can you hear me?
Can you hear me now? Okay.
I like your headphones. But you headphones so you can hear it. Turn on your headphones. Now lower your headphones.
Okay. Better. Okay. I can hear you now.
Great.
Awesome. Good afternoon, Lieutenant Governors Peggy Flanagan. Welcome to my shows.
Thank you so much for having me. I'm sorry that I can't be with you in person.
That's okay. Let's talk about what's going on right now at the state capitol and regarding the COVID-19. The time is yours.
Well, we are all working as hard as we can to make sure that we are able to respond quickly and efficiently to meet the needs of people all across the state of Minnesota as we address this pandemic of COVID-19. We are really appreciative of the people of Minnesota who have complied with the stay-at-home order, which has allowed us to continue to build out the healthcare capacity that we need to respond for what will surely be an increase in COVID infections. So while we know for many people it is difficult to stay at home, you are saving lives of fellow Minnesotans. And I did want to just mention here as we are getting started, the governor and I are deeply sorry for the kind of just discrimination and targeting of the Asian community right now. We know that not all Minnesotans have responded in this way, but too many Minnesotans have discriminated against the Asian community, and we are working in partnership with our Department of Human Rights and organizations, CAL being one of them, to ensure that we are able to support the community and respond during this time, and that racism and discrimination and the targeting of a community is completely unacceptable. And the governor and I are doing everything that we can to stand with you.
Thank you. And how are we doing with the COVID-19 compared to other states?
So I would say that we are responding well. Minnesotans are following the stay-at-home order, and we know this based on data from cell phone towers, seeing that people are staying close to home, as well as reports from the Department of Public Safety with regards to traffic on the road. So the people are staying at home, but we also have a really robust healthcare community here across the entire state who are working together, who are working to ensure that we are going to be able to expand to meet the capacity of the needs for folks who will need to be hospitalized, but also need intensive care during the coming weeks and months. But I would say that the governor and I also remain frustrated with the slow response of the federal government to get us the additional PPE or personal protective equipment for our healthcare providers, as well as ventilators that will be needed to support people as they are impacted by COVID-19. So I feel confident, especially in Governor Walz's leadership. I think he is a teacher, and I think has been trying to guide people through the data and the information that we have that has led to the decisions that we've made. But he also, was a command sergeant major in the Army National Guard for 24 years. And that absolutely impacts the way that he leads, and he leads forward with a plan in place, and we don't move until we have a plan. So I feel confident, but I also know that what we're doing is working because Minnesotans are staying home and are following directions. So we're grateful, and this wouldn't work unless we were able to all do it together.
Right. What about the mask? I still see a lot of people walking around without the mask on, even go to the store and have without the mask on. And does government going to do any order for people to mask on?
So right now, the guidance is that we need to ensure that the masks are primarily used within the hospital setting or within the healthcare settings. And know that we are looking for additional guidance through the Department of Health because masks are the N95s or the masks that healthcare professionals use are in short supply. We are asking that those primarily be used for people who work in healthcare, or also those who might find themselves to be immunocompromised. If you see more people who are wearing the cloth masks around, or homemade masks, then what those really do is protect others from you. So an increase in folks wearing those, I think, while it doesn't prevent people from getting COVID-19, our understanding is that it may protect others. If you maybe have COVID-19 or are asymptomatic and in community going to the store, that type of thing, that those can be helpful. But we will continue to look to guidance through the Department of Health, also through the CDC for guidance there. But right now we want as many of those masks to go to people who are providing that critical health care right now.
Yeah, because I know that my wife spent about 2 weeks just to sew those homemade masks and donated to hospitals for the hospital to use.
That's tremendous.
Yeah, thank you. And
so tell your wife thank you. And we know that more Minnesotans have been responding in that way.
Yeah, she's just go to the store today to pick up more materials to do the masks.
That's wonderful.
Yeah, she's be doing that. And anything else that we need to know about the COVID-19?
I think the most important thing is that we are asking people to stay home, to ensure that if you are traveling outside your home, you're going to get essentials. So that means groceries, to the pharmacy. People can feel free to take a walk, to get outside. But we absolutely need people to practice social distancing. So keeping 6 feet between themselves and people who they don't live with from day to day, and also to ensure that folks are washing their hands. It is a really simple thing that I think can do a tremendous amount to prevent the spread of COVID-19. And would just encourage people, it's important that we also don't play pickup games of basketball or soccer or team sports during this time as well, to keep that social distance and to keep our children off playgrounds as well. That's another way that it can spread. But would say this, that we know that this is a really difficult time for everyone, and we are so grateful for the sacrifices that people have made to try to give us an opportunity to be able to build out the capacity within our healthcare system to respond. So we will continue to talk to you. I hope that we can have another opportunity to speak to ensure that your listeners are getting the information that they need, and that we are communicating as much as possible. And again, also knowing that it is completely unacceptable for particular communities to be targeted. This virus doesn't discriminate, and Minnesotans shouldn't either. So especially to the Hmong community, we see you, we hear you, we value you, and the governor and I know that the Hmong community is a critical part of Minnesota.
Thank you for hearing from you and from the governor. It's awesome, and I'll definitely pass on the word to the community. And is there anything else that we need to know in the state of Minnesota from you and from the governor?
I think that covers it. But just take care in this moment, when I know that in my community, in the Native community, we during times of crisis, we want to come together. And it's really counterintuitive that we need to stay apart right now. And so just would encourage you to practice, again, that social distancing. But that doesn't mean that you can't check on the people that you love. Call, text, FaceTime, and make sure that while we have to physically distance, that we can still stay connected electronically. And in this moment, that's really important for all of us.
Right. Yes, it was. Yesterday was my birthday, and so my children and I we do Zoom eating.
Yeah. Well, happy birthday.
Thank you. One of my questions for you, as from the governor, also from the state of Minnesota and from the federal, was talking about tenants' rights, and tenants don't have to pay their rent during this pandemic. But one question for you from the governor is, what about the landlords? The landlord have a mortgage to pay, without receiving the rent payment from the tenants, how the landlord going to pay for the mortgage?
Sure. So right now, the governor did pass an executive order that puts a moratorium on evictions. So people can't be evicted from their property during a state of emergency. But we are working in partnership with Minnesota Housing, and are having ongoing conversations with landlords. I am also, as Lieutenant Governor, a renter, and so that's something that I think about all the time. We are encouraging lenders, mortgage companies, to also be flexible. If we need to take additional action there, we may need to do so. But we realize that this is certainly not an ideal situation. But what we need to do is to keep people at home as much as we can. But here's another thing that I think is important that we're asking the legislature to move on. In the governor's office, we can pass executive orders that prevent people from being evicted, but we cannot pass anything that has to do with rental assistance. That is something that the legislature needs to do. So on April 14th, the legislature will be going back into session. And we are encouraging them at that time to also pass a rental assistance package that would meet the needs of renters who may find themselves in a difficult financial situation, but then also that provides support for landlords as well. So that's one of the things we're encouraging the legislature to do, and would ask you and also your audience to do the same, to tell their legislators that it's important that this rental assistance package is passed.
Okay. What about the homeowners? Homeowners also facing the same pandemic, just like the renters, and they probably don't have money to pay for the mortgage during this time too.
So we're also looking at what we can do there, but we do know that there have been some banks who have been willing to allow people 3 months, for example, to not have to pay their mortgage. In some instances, that becomes due right away at the end of those 3 months, which I know is not ideal. Other lenders are tacking those 3 months on to the end of the loan, which I think is a better way to approach it. But we are in conversation with with lenders about that. We may need to take additional action. I'm not sure what that looks like at this time, but I do know that other states have done that to also give relief to homeowners. We don't want people one to lose their home, but also to be in a financial situation that they just can't dig themselves out of. So those are all things that we're thinking about right now.
Yeah, that'd be nice to have those payment to toward the end the payment term instead of lump sum payment at the end of the pandemic. Yeah.
And I think, you know, it's also frankly good for the lender that they'll be able to keep people right in their homes and paying their mortgages as well. And we certainly don't need another housing crisis on top of this pandemic.
Right, because the lenders is not in the business of holding properties. So they don't want anybody to go foreclose. But during this time, that people don't have the money to pay for, and so that could be an issue for everybody.
That's right.
Okay. All right. Thank you so much for being on my shows, and I look forward to talk to you more in the future.
That sounds great. Thank you so much. Happy birthday again.
Thank you. One last thing. Okay. Yeah. Thank you so much. One last thing from you. You have anything to pass on to the community before we end the shows? Just
that the governor and I are so grateful to Minnesotans and of course to your audience for doing what they can to stay home, to stay safe, and to take care of one another. So thank you. We stand with you, and we're just grateful to be able to serve in this moment and to be in partnership with all of you.
Thank you so much.
Thank you.
Okay.